Thanks so much, Andrea, and good afternoon, everyone. I'm going to be talking about the impact of politics on practice, and I'm going to give you a couple of very specific case studies of what some political challenges that we've faced and what the outcome has been. First of all, the package that we're providing with the Step Up project is the comprehensive package recommended by WHO, UNODC, and UNAIDS. So, in fact, TB-HIV Care has been providing mobile health services that include most of the elements related to HIV, TB, STIs, for the general population for many years, for more than 10 years. But now recently, with our services for people who inject drugs, we've added needle syringe programs and opiate substitution treatment. We started the Step Up project by doing a formative assessment to identify the number of people who inject drugs that are existing in the different municipalities, and where the sites where they inject, and identification of locations for peer-led outreach, and then health services for linkage to care. And really throughout this process from 2014-15, we've been consulting with people at different levels of government, from national, provincial, and local government. And we've also consulted with service users through community consultation workshops and and formation of community advisory groups, because as we know, nothing for us without us. We need to ensure that the services are tailored to the needs of the people, or the clients that we're serving. And then we developed our model for implementation with outreach services, with a drop-in center, and referral to other services. So just a summary over a one-year period from April of 2017 to March of 2018, you can see that we reached over 2,000 individual clients. We have a unique identifier, so we can track how many individuals we reach, and with 24,000 contacts for those clients. The two case studies of political blockage of service delivery that I'm going to talk about, one is from Cape Town, an area called Belleville, and the second one is eThekwini, which most people know as Durban. So in Belleville, when we started initiating the services, we actually, our peers went out into the area and to sites, the hotspots where we'd identified clients, and started already collecting needles and syringes that had been discarded by people who inject drugs in the parks and in the areas. And then we started our full service delivery in June of 2015. Things went well until October, when we had some community members complain. And then we had meetings with the South African Police Services and Environmental Health. But then at the end of October, we were asked to suspend services, and it got quite extensive media coverage, including in the local newspaper, the Cape Argus, with the headline, "Cape Clinic on Wheels Banned." And it was a specific councillor, Pinor, from that area, who was blocking the services. And so we involved the person responsible for her health in the city council, Councillor Mamkele. I should just note, over that period, from August to November of 2015, we monitored human rights abuses, and these included 70 of the 108 were in the Belleville area, and it included a number. We included needles and syringes being broken or taken away, or arrests based on possession of needles and syringes. So then subsequently, we had a number of meetings and presentations with different stakeholders, including the Provincial Council on AIDS. I must say the Provincial Minister of Health was very supportive for us. And it was agreed then we had to have another consultation with the ward councillor, which we did, and we were able to resolve the issue by moving the services away from the one park where the complaints were mostly made, about to another area near a taxi rank. But you can just see the impact of moving. We had to move initially the services to next to a police station. So clearly the number of beneficiaries accessing the services decreased during that time until we could go to another outreach area in Teddington Road. So that ultimately was resolved. In eThekwini in Durban, we had, by that stage, the provision of services for key populations, including needle syringe programs and opiate substitution treatment, had been included in our new national strategic plan against HIV, AIDS, and HIV, TB, and STIs. And also in the provincial implementation plan and the district implementation plans for that metropolitan area. And we also established a network of people who use drugs, and we had support from the Provincial Council on AIDS. We'd initiated people on opiate substitution treatment, and TB HIV Care was really the only organization providing these kinds of services. And since June of 2015, there were more than 13,000 contacts made and more than 1,000 HIV tests done. But then, unfortunately, the city and the deputy mayor, particularly in the city of eThekwini, started threatening to end our needle and syringe service. That was the particular element that they were worried about because of environmental health. And so then, unfortunately, in fact, in February of 2018, there was a lot of media coverage. There were a few needles and syringes that washed up on the beach in Durban. Now, I think many of you know that Durban is a tourist center, and so it became a big political issue that there were needles and syringes there. There was no evidence that they were the syringes and needles that TB HIV Care had distributed, and but nonetheless, it was linked to our project. And then, so just to show you the roadmap from 2015 and all of the many consultations we'd had with the Metro. We met with them first before the South African AIDS Conference in 2015 with the Premier's office and the city. You can see a long line of consultations and points at which there was confirmation that we were delivering the services responsibly, including the needle syringe program, even in involvement with the environmental health unit. But then, even in February 2017, there was a complaint about the needles and syringes. So we trained the municipal workers on collection of used needles and syringes, and we also set up a hotline and said, if there are any reports, call us and our team will go the same day and pick them up. So as a result of this media coverage in February of this year, 2018, we tried to be much more rigorous and restricted access to some extent to needles and syringes. We asked people to return their used needles and syringes, and the number that we handed out were to some extent linked, not exactly, but we're linked with the number of needles and syringes that they returned. But then ultimately in May, we had to stop the service altogether. And we're still in this consultation process. Now, what they said was that we needed to apply for a special permit to continue the service. And so we did. We followed the administrative process. We submitted that in June. They promised a response by July, and we still haven't had it. It's going from one department to the next within the city. I have to acknowledge Monique Marks from Durban University of Technology, as well as Calvania, our local coordinator, and Andrea, who've really been engaging very much and trying to keep up the advocacy pressure. In fact, there is a meeting planned on the 26th of October that Monique is coming back specially from a conference overseas to ensure that she meets the city manager. We're very hopeful that it will be resolved. But I just wanted to share this quotation from one of our clients who said, and you can read the whole quote, but I'll read part of it. From the time the needle exchange stopped, things have been much harder in obtaining clean needles. Using the same needle has caused me to get sores, swollen arms, sore muscles due to blunt needles. I don't have enough money to buy a clean needle all the time, and pharmacists don't want to sell them. So you can see the individual impact that this has had on one client, and we're dealing with many clients, and as mentioned earlier, we're really the only service provider in that area. So we feel we have a very rigorous process of delivering the service. We've monitored returns. We had over 80% return rate in the last 2 months of the service. We provide, you can see a picture of these personal sharp bins. So even if there's no public area or a sharps container, the clients can dispose of the needles themselves. We also train our peers and the clients on needle collection, and they even risk arrest sometimes by bringing back needles that aren't even theirs, but from the area where they're congregating. And many risk arrest to do this. So I think, again, Palani, you were commenting, I think at the beginning of this meeting, we really do have a far way to go. We're really at the beginning of harm reduction services in South Africa, and it's quite a hostile environment. Although the policy, the National Strategic Plan supports it, and program managers at different levels support it, we are getting this political interference. And just an interesting comparison, these are exactly the same needles and syringes that diabetics use. And there was a study looking at, there are almost 30,000 new diabetes patients in KwaZulu-Natal, the province where Durban is. In 2017, 40% use insulin and inject. And you can see that 88% of people disposed of sharps directly into a bin, no bottle first. They flush them down toilets. And 64% of hospitals don't have a satisfactory disposal. 57% showed infectious waste lying outside. Now, clearly, this is not ideal. We need to ensure that there's proper management of needles and syringes for both diabetics and people who inject drugs. But I think it's the double standard that I want to draw attention to. And the politicians aren't saying, we have to stop giving needles and syringes to diabetics, but they are saying that for people who inject drugs. So if eThekwini actually cared about public health, then they would have sharps bins in public spaces. They wouldn't arrest people who are carrying sharps. They wouldn't have taken away the only means of disposal, which was the service that we were providing with our peer outreach. And they would promote and fund needle and syringe programs. And they should realize that people who inject drugs are dying because of the lack of sterile injecting equipment. It leads to needle sharing, reuse of non-sterile needles, abscesses, sepsis, transmission of HIV and HCV and other infections. And mortality can be increased as a result. So, and clearly, there's no single recorded death in South Africa due to a needle stick injury from an injection drug users. But the key lessons, I think, from this for us is that politics and politicians do have the power to block service delivery. So we have to make sure that there's extensive consultation and buy-in every step of the way. And also not to be complacent. We thought we'd started our service, we were going along fine from 2015, and then 3 years later is when politicians now intervened to block the service. And as we've been hearing throughout the week, decriminalization and regulation are needed to create a supportive environment for service delivery so that politicians will be less likely to block services. And these are essential services, evidence-based health services, and health is a human right that needs to be protected. I just want to acknowledge our funders, and thanks for your attention.